Cool, thank you. So welcome everyone. Good morning to the City of St. Louis Department of Health Joint Boards of Health and Hospitals meeting for Thursday, September 16th. Good morning and welcome to all of our board members and health department staff and our visitors. I would like to call the meeting to order. And second, I would like to, if somebody could please give a motion to approve the Zoom video from August 19th, our previous board meeting, to serve as our minutes from that meeting.
I move approval of the Zoom meeting minutes.
Thank you, Dr. Ross. May I have a second, please?
Second.
Second.
All in favor?
Aye.
Aye.
Anybody opposed? Wonderful, thank you. So that has passed, and I will pass it on to Dr. Eckel to talk about the public health declaration.
Good morning, board. Thank you all for being here. Thank you all for your support over the last 2.5 years as we've navigated through the COVID-19 pandemic, and we're still finding our way through as we get new recommendations from the CDC and other national organizations. One of the things that has been highlighted over the course of the pandemic are the inequities that were pre-existed. And so we, last year, the board declared racism as a public health issue, and that was a duty on that was put on the health department to really do the same. And so, unfortunately, it's taken us a little bit more time than when we wanted. We wanted to take this time to make a declaration about racism, and not only just racism in general, but particularly racism in the city of St. Louis, and make sure and also establish some action steps that the health department can take to do its part in addressing the issue in our jurisdiction. And so a declaration and proclamation has been prepared for the board, since technically the health department isn't a governing body. It wouldn't be appropriate for us to do it. So we were asking the board to make this proclamation on our behalf as it relates to declaring racism, not only a public health issue, but an issue of humanity. And so there is a document, if you give me a moment. I'm not sure if Harold or Kim, if you all have it up on your screen, you all can share it as well. So my computer's moving a little slow this morning.
Don't have it immediately, but give me a moment.
I'm sorry, Dr. Eccles, would you clarify what you need from the board procedurally? So, because we had already voted to declare racism as a public health issue. And now you want us to vote to approve the language of the proclamation, is that correct?
All right, the language of the proclamation, and technically the board will need to issue the proclamation on behalf of the health department.
Thank you very much.
Everyone see that?
Yes. Kim, if you can scroll down. There you go. So I'll just read through the language that has been prepared for the board. So, whereas in the United States, there is a constitutional guarantee that no person or group will be denied the protection under the law that is enjoyed by similar persons or groups, and the Equal Protection Clause of the Missouri Constitution provides that all persons are created equal and are entitled to equal rights and opportunity under the law. And whereas a well-accepted definition for racism is prejudice combined with social and institutional power, creating a system of advantage based on skin color. And whereas the historic foundation of systemic racism in the city of St. Louis has been detailed in landmark court cases with local impact, including Dred Scott versus Sanford, Buchanan versus Worley, Shelley versus Kramer, Liddell versus the Board of Education for the city of St. Louis, Davis versus St. Louis Housing Authority, Lloyd Gaines versus the University of Missouri, McDonnell Davis Corporation versus Green. And whereas in our multiracial city, access to healthcare, criminal justice, economic opportunity, education, employment, food security, good health, goodwill towards fellow residents, and housing are all negatively impacted by systematic racism. And whereas all governmental departments in the city of St. Louis have a role to play in developing concrete strategies in our efforts to ending systemic citywide racial injustice and achieving racial equality across the city. And whereas racism unfairly disadvantages certain individuals and segments of our community while unfairly giving advantages to others, limiting the collaborative potential of our great city. And now, therefore, the City of St. Louis Department of Health boards of health and hospitals do hereby proclaim racism in the City of St. Louis is a crisis, and will work with the City of St. Louis Department of Health to begin the immediate work to, one, establish a racial equity and fairness training program for all City of St. Louis Department of Health employees, and create a process to find out from residents where they see racism in the delivery of health services in the city, and review existing and future City of St. Louis Department of Health policies and practices through an equity and fairness lens. In witness thereof, I have hereunto set my hand on the 16th day of September in the year 2021.
I move approval of this really critical, important document. Thank you for the powerful language.
I second. Thank you for drafting this, Dr. Eccles and team.
So we have a motion and a second. All in favor?
Aye.
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 Any in opposition? There is none. Ayes have it. So the City of St. Louis Department of Health, through its joint boards of health and hospitals, will adopt this proclamation declaring racism a public health crisis in the city of St. Louis. Thank you. And I think the next agenda item, unless are there any questions?
So this will be posted on the website, and in what other areas?
I'm working to post it on the website as well as in the City of St. Louis Department of Health. So we'll have a hard copy. That hard copy will need to be signed by the chair.
Dr. Eckel, in the second clause of the proclamation, it does say something about investigating the extent to which racism currently exists in the delivery of health services in the city of St. Louis. Do you anticipate the department doing any kind of an investigation or independent review of the extent of that racism in existing health services?
So that will be a critical initiative. So that will be, that's a huge task to lift as just a health department. And so we would really work closely with our academic partners to do that work. And so that's something that we will need to start planning to do because we want to make sure that we're holding ourselves accountable to the language that's included in the proclamation.
Do you have the funding and staff capacity to undertake such work?
So we're building staff capacity. So additional positions have been approved for the health department, but again, that's still the depth of work that needs to be done for that is something that we wouldn't be able to do as a single unit.
Makes sense. Thank you.
I have a question. Is it possible, because this also implies other other parts of city government? Is it possible to do you have a relationship with any other officials that are already thinking in this direction that might share and or be interested in a proclamation like in housing or police or anything like that? So it could be a citywide effort.
All right, so another a separate citywide proclamation was drafted earlier, but we didn't get any, haven't gotten a lot of traction on that one. So, but we do know that there are other organizations such as the Civil Rights Enforcement Agency, or CREA. We've had discussions with them, particularly as we, a few months ago, we prepared an application for the W. Kellogg Foundation to have to implement a citywide approach to addressing racism and making sure that training was available for developed and available for all civil service and appointing authorities in the city of St. Louis. That project wasn't funded, but we are looking to use that same scope of work to secure additional funding to support the work that needs to be done.
And I'll just piggyback on another question that Linda had. In terms of capacity of the health department to do the work. I know that there is a task force and a group in the health department to work on making the health department an equitable and social justice based organization. Would it be part of this group's work as well?
That could definitely be a part of the group. So we've had some turnover in that group. So we're in the process of recruiting additional staff to participate in the racial equity work group, but that is something that could be a part of their scope. And I see Candace De Silva has her hand raised. And Candace, you're on mute.
Good morning, sorry. Thank you so much for bringing forth this proclamation. Back in November of 2019, you provided to us some really phenomenal a workshop called Undoing Racism, to both deepen the understanding of systemic racism, but also to be instrumental in anti-racism work. Will similar workshops and professional development opportunities be made broadly available? It was really a great experience, and so want to make sure that we can continue offering that to more staff.
Yeah, so the training that Candace is referencing is the Undoing Racism training that's offered by the People's Institute. So we had all of the executive leadership participate in that training. And the goal of that training was to help our leadership team understand how systems work, and also understand the idea of intersectionality and how that influences our ability to actually do the work and how we serve the individuals in our jurisdiction. So that's something that we were looking to do on an annual basis, but then COVID happened. And so we will look to resume our conversations with the People's Institute about providing that training to the Department of Health staff.
Thank you so much.
Thank you, Dr. Eccles and Department of Health staff for working on this timely and critical document. And we have board members that are certainly interested in moving this work forward, and in terms of operationalizing the proclamation and making it real, and making sure the rubber is meeting the road, and it moves beyond just a proclamation. You know, please reach out to the board for any assistance you might need in making that happen. Do we have any more comments or questions about the proclamation?
Sue has her hand raised.
Yeah, just a comment. With regards to the work group within the health department, I think when that was first convened, there were a few board members that were also there to help support that work. And so I would just want to raise that up, that as you bring that work group forward again, if that is something that would be helpful, I think that we would be happy to support in any way that the staff would need.
Absolutely. Thank you for that.
Thank you. All right, Dr. Eccles, you are also our next agenda item with our COVID update.
All right, so I'll have a few slides to share with the group this morning. You all can let me know if you can see my screen.
Yes.
So each week, the health department provides this a weekly update. And this was necessary to make sure that our stakeholders, including elected officials in the mayor's office, are informed about what's happening in our jurisdiction as it relates to the spread of SARS-CoV-2 and its impact on our community. So this was the last update on the 12th, representing information that has been collected up to the week prior. First, I'll start with the Missouri COVID-19 data. So right now, everyone's familiar with the Delta variant. And so right now, the Delta variant is accounting for over 96% of all cases in the state of Missouri, which is also impacting the city of St. Louis and the St. Louis region. However, of concern is, with ongoing transmission, the likelihood of additional variants developing is a real risk. And so what we have been focusing on is stopping the spread of the virus. And so when we have engaged town halls and groups about issues related to COVID-19 and SARS-CoV-2 and COVID-19 vaccinations, we really emphasize the importance of focusing on the virus and not just COVID-19, because the way things have been shared, particularly in the media, the way the information is phrased, can be somewhat misleading to the community. So we make it really clear that our focus is stopping the spread of the virus, and there's mitigation measures in place that we've recommended since the beginning of the pandemic, and then also continuing to encourage individuals who are eligible to receive a COVID-19 vaccine to do so. There are one new variant of concern, which is a variant of interest, the new variant, which has been in the media quite a bit lately. We don't know a lot about its resistance to the currently available COVID-19 vaccines. Those studies are underway, but we do note that, again, additional variants will continue to develop if we don't get a grapple on this and slowing the spread of the virus in our community. In the state, so to date, roughly 657,000 cases of COVID-19 have been reported. Over the last 7 days, 12,173 cases have been reported across the state of Missouri, which has been a slight increase compared to the previous 7 days data that was issued last week. So we're seeing a slight increase, and some of that may be due to activity that occurred over the course of the Labor Day weekend. There were several gatherings and events that occurred not only in the city of St. Louis, but across the state. So that will likely influence those numbers. And so the city of St. Louis Department of Health, we're looking closely at the data. We're anticipating seeing an increase in cases likely by the end of this week or next week. For vaccination, so roughly 5.9 million doses of COVID-19 vaccines have been administered in the state of Missouri. The state is reporting almost 53% of the eligible population, meaning those who are 12 years of age and older, initiating the vaccination process, meaning they received 1 dose of the Moderna Pfizer vaccine or 1 dose of the Johnson & Johnson vaccine. And then of the population that's eligible, roughly 46.5% of the individuals have completed the vaccination process, meaning received 2 doses of the Moderna and Pfizer vaccines in 14 days have passed, or 1 dose of the Johnson & Johnson vaccine in 14 days have passed. Hospitalization. So overall, things seem to be trending down overall across all the hospital systems in the state. To date, right now there's 1,871 COVID-19 hospitalized patients, with the remaining total hospital bed capacity, including inpatient and outpatient beds, remaining at 29%. But the inpatient bed capacity alone is roughly 19%. So the concern here is that we've established a plateau, but we're not really seeing a huge increase or decrease in COVID-19 cases. But we know that last year around the same time, we experienced another surge. And so if we were to experience another surge at this point in time, that would really overwhelm our hospital systems and the public health department. I'm focusing on the city of St. Louis data. So this is a map that by the New York Times. So based on just on this heat map, what we're seeing is that the St. Louis region is faring a little bit better than surrounding regions, with the highest incidence or case rates being in the state of Tennessee and Kentucky, and it seems to be moving eastward towards West Virginia and the Northeast. The 7-day average. So right now we've met one of our goals, which is the average of new confirmed cases. So we had 1 day of meeting the goal of 35 or less, a fewer cases in the city of St. Louis. But our other 7-day metrics are not being met at this point in time. And so the new hospitalizations, as well as the average number of people hospitalized due to COVID-19 disease, are higher than where we want it to be, as well as our percent positivity. Right now, our percent positivity is hovering around 8, which is a slight decrease from last week. But that's something we're paying really close attention to. Again, being mindful of that there was a holiday weekend where there was a lot of gathering that occurred over the last weekend. Overall, the totals. Right now, the city of St. Louis is reporting 26,477 confirmed COVID-19 cases and 577 COVID-19 deaths. Overall, the overall positivity rate over the course of the pandemic is at 8.1. So overall, when we look at our performance, we've done fared out a little better than surrounding jurisdictions, but we also understand that we're not out of the woods yet. There's still a lot of work to be done to get us through the remaining phases of the COVID-19 pandemic. Cases by zip code. So overall, when we look at the raw case counts, the highest number of cases that are being reported are in the southeastern part of the city. But when we look at the burden of disease, when we look at the case rate, which is on the right-hand side, we're seeing that the northern part of the city is experiencing a heavier burden of disease in its zip codes, particularly in 63112, 115, and 106. And then in the southeast part, we have 63111, which is also one of our most populous zip codes in the city of St. Louis. So when we look at this data, we're using this to inform our activities, particularly where we place resources and where we hold vaccination clinics. So we've been reaching out to organizations that are holding events in these various areas to make sure that we provide opportunities for individuals in those areas to receive a COVID-19 vaccine. And we're also using this data to inform where we issue information and what groups we issue information to. So we know that there are neighborhood associations and other organizations that have a captive audience in some of these zip codes. And so we've worked with them to provide information during town halls and other meetings. Overall, African Americans continue to account for about 70% of the newly reported COVID-19 cases, which is concerning. We know that population is disproportionately impacted by other chronic illnesses that place individuals at higher risk for severe complications, hospitalizations, and death if they're infected with SARS-CoV-2. Overall, the heat map just shows that there's ongoing spread across the city of St. Louis. So every neighborhood, every zip code in the city of St. Louis is impacted. There's one hotspot in the southeastern part of the city that we continue to monitor. But overall, we've made some improvement. But the takeaway that we typically ask people to get from this is that there's still ongoing transmission in every neighborhood and every zip code in the city of St. Louis. And this is really concerning for us. So this is the breakdown by age. And so if you look at the trends over the last 3 months, we've seen an increased proportion of cases being accounted for amongst the youth, so those who are 19 years of age and younger. And the largest proportion of growth has been amongst those individuals who are age 10 and younger. This is concerning for us because we know that they are not eligible to receive a COVID-19 vaccine. So we've been working with our partners to make sure that parents and guardians understand the importance of having discussions with their youth about COVID-19, the COVID-19 mitigation measures, prevention measures as we move forward, especially as we approach the fall and winter months. And we've also had discussions directly with CDC staff about communication materials for parents. And so we're going to be working with them to get more information, receive information, and share that information with the school systems in the city of St. Louis so they can distribute it to their networks. In the city, our vaccination rate, so we are inching towards, or maybe crawling towards herd immunity. Right now, the percentage of those who are eligible to receive a COVID-19 vaccine who have initiated the vaccination process, roughly 54%, and those who have completed the vaccination process is 46.8%. So there's still a ways to go here. We have implemented additional programs. So we have the incentive program, not only for City of St. Louis employees, but we also have an incentive program for individuals in the community who opt to get a COVID-19 vaccine. So we're offering $100 gift cards for individuals who receive the COVID-19 vaccination during one of our clinics. We'll also be working with other organizations that we're partnering with to make the gift cards available at other events that may not be sponsored by the City of St. Louis Department of Health. And this uptake, so overall, I mean, the takeaway here is, it's still in the northern part of the city, we have the lowest vaccine uptake, whether you look at individuals who have initiated the vaccination process and those who have completed the vaccination process. We have a lot of work to do in the northern part of the city, which has the lowest vaccine uptake rates in the city of St. Louis. And so we will continue our efforts to host vaccination clinics, provide information, use our social media platforms, as well as other media platforms that we have available to us through our partnership with STLTV, which is part of the utilities division of the city of St. Louis, and also some of our private partners to make sure that we are doing our very best to reach as many people as possible, but also hold forums in a more intimate setting so we can answer some of those questions that individuals may have, particularly for those individuals who may not be comfortable asking questions in large forums or in group settings, so that their questions too can be answered. All right. And that's the COVID-19 update.
Thank you, Dr. Eccles. Do we have any questions or comments?
Yes, a quick. So first of all, regarding herd immunity, we have to realize that the bar has changed, and that because of the prevalence of the Delta variant, herd immunity is more like 85 to 90% vaccination, not the 70 to 75% threshold we had earlier this year. And so we have a higher bar to achieve in order to get herd immunity. That's the bad news. The good news, and Fred, I wanted to comment on this. The good news is that this is data that I saw in the CDC, was reported by the New York Times about 3 weeks ago. The percentage of Americans who say flat outright they will not get the COVID vaccination has actually declined. 6 months ago, it was more like 40%. Then 3 months ago was about 25%. And the most recent report shows there's about 15%. So we seem to be making headway, and I suspect it's mostly because of the mandates by jobs are pushing individuals to get vaccinations. Do you think that's the case?
I think that's part of it. So, when you start to impact individuals' employment and their livelihood, that really changes stakes for individuals. I think we all understand, or at least we've seen the economic impact that the pandemic has had on individuals, particularly those in the service industry, where there's in hospital systems, food and beverage industries. And so as these mandates come out, people really have to think really hard about how they're going to feed their families, how they're going to keep a roof over their head. And so that really changes the game for individuals. But we also are very mindful that, as we implement policies that we deem to be necessary to protect the population's health, I also think that we have to continue to do our very best to communicate well with individuals. So making sure they understand why these policies are being implemented, and also give them opportunities to provide feedback. So one of the things that the city did is we held a forum for city employees where they could ask questions about the new administrative regulation 151 that was enforced by the Department of Personnel in the mayor's office related to employee vaccinations for COVID-19. Because we really need to make sure they have a platform to be heard. So there may be some concerns or some issues that head officials may not be aware of, and they may not be addressed in the policy. And so I think creating those forms will help create additional buy-in for these policies before they're implemented.
Thanks, Fred.
I see Tim.
Yeah, Dr. Eccles, I think Dr. Ross asked a related question, or you covered a lot of the ground I wanted. I wish that that number was higher than it is, the vaccination rate. And first of all, thanks for the thorough report. I wish that vaccination rate was higher, certainly. I know you've been working tirelessly with your team to get that up higher. You know, I was just looking at the state vaccination rate, and we are among the higher counties in the state, so that's good news. But you know, we all know that Missouri has some pretty low vaccinated counties. So you know, we've been doing everything we can. I know you've been doing messaging, you've been making the vaccine available in all sorts of corners of the county. You know, could you speak a little bit more to what you think the hesitation is, and what more the board could be doing, and you know, how we can get that number from 55 to that 80 or 90 that Dr. Ross is talking about?
And so I think so this is, as you all know, a very complex issue. So I think one thing I've had to do is really step back and make sure that my own expectations as it relates to vaccination rates are realistic. And so in order to do that, you really have to understand what was happening before COVID-19 actually happened, right? So when we think about vaccine hesitancy, whether school-age vaccinations or adult immunizations, that's been hesitancy prior to COVID-19 starting. In addition to that, we also have to be mindful of the plight that our communities in the city of St. Louis have had to endure over the last several decades. This past Monday, I participated in a town hall session with retired individuals. So a lot of the individuals were aged late 60s up to early to mid 80s, right? And so when we start having discussions about hospital number one and hospital number two, and how all these things have really evolved in the delivery of healthcare services has evolved in minority communities. Essentially what they've seen is resources stripped away. They've been exploited due to medical research and other things. They've been really disenfranchised. And so even though now we are coming to them and saying, hey, we have this life-saving tool, what they remember is we were mistreated by you before. So why should we trust you now? So I don't think our expectation to reach herd immunity immediately, I don't think that was realistic. I think we really had to look at the nature of what's happening in our community. We have to look at the history of our community. And the opportunity that we have now is we have an opportunity to really create a more productive path forward. So we have an opportunity to really engage them without any hidden agendas, to just provide them with accurate information. So when I go out to these groups, I say, hey, I'm not here to, coerce you to make any particular decision. I just want to make sure you have accurate information for you and your family so you can be the best health advocate you possibly can. And so by you implementing that approach, we're able to really set the foundation and set the tone for a productive meeting and an engaging encounter. And so that's what we've really seen. But that has to be done continuously. It can't just be done for COVID-19. This needs to be done throughout over the upcoming years regularly with our community. If we're really serious about establishing trust, because it goes beyond COVID-19 when we really think about it. It's really about preventive health, right? So when we think about preventive health, we also need to focus on making sure individuals are following up with their medical providers on a regular basis, adhering to medical instructions, but they have to start engaging the health system. As long as they don't engage the health system, that won't happen. And so by working with them regularly and genuinely and truly meeting them where they are, whether that means in a gymnasium that's in the North City or that's in a church basement, then that's what we have to do. But we have to really be clear about our mission as a health department and be dedicated to achieving that mission, regardless of what challenges we may face, because we do have resources available for the community, but they won't take advantage of those resources if they don't trust us.
Yeah, if I could connect the dots real quick between the first item we spoke about and the second one, when we actually say that racism is a public health crisis, that speaks to the trust issue, and in those whereases you spoke about what you just addressed. So I wonder if actually taking that proclamation, putting on a big poster and putting it in the in the venues where you are would help people say, oh, I guess they're serious. Anyways, that's just a comment.
I think posting the proclamation that may be helpful, but I think people will know that we're serious by our actions. So our actions are really the evidence that we're serious about achieving the mission that's been assigned to this health department. So that's what we have to do. I think they'll read a proclamation, but they'll forget about it. But if they continuously see us out and engaging the community in a way that's culturally and linguistically responsible, that's what they'll remember.
So I have a question from a communications perspective. It makes a lot of sense what you're saying. What kind of staffing or resources do we need to get out there regularly to all areas of our community, particularly those that have been ignored and disenfranchised? You think, because I totally agree with what you're saying, but it's a big effort. I know it can be done, but do we have any additional funds, or is this something we should think about for next year's budget to get this boots on the ground community engagement on an ongoing basis?
Absolutely. So one of the job classification that can really do this work well is the community health workers. And so through the ARPA funds, we've been afforded $1 million to establish a community health worker program. So we're working with the mayor's office to get that up and going. We have to work with the Department of Personnel to actually get the job classification established in the city of St. Louis, but then hiring individuals. But we also have to make sure that we're very intentional about hiring a diverse group, because we want to make sure we're not just hiring African Americans, not just hiring Caucasians. We really need to hire a diverse group, because we have refugees in our communities. We have Hispanic, Latinx individuals in our community. So we really need to make sure that the program represents the community that we're asking them to serve as well. So those are part of the plans, but you also know that the ARPA funds aren't infinite.
Right.
And so we also have to make sure that there's a plan to transition those positions to general revenue so that this work is sustainable over a long period of time.
Great, thank you.
Any additional questions? All right, thank you for the COVID update, Dr. Eccles. And next on our agenda is Dr. Moshe with and Abigail Anderson with a mental health briefing. Is Dr. Moshe available? I know.
Yes. Good morning to everybody. Yeah.
Good morning.
Yeah. We are here this morning together with my colleague Abigail. We managed to pull some information from the medical registry that we are going to present, and it's all about the mental health. The aim is to give a snapshot about the situation of mental health here in the city of St. Louis in comparison to the state and the county. So we had some data limitation, but I think the snapshot will help to enlighten us what is the current situation in the city. So I would like to invite my colleague Abigail to proceed with the presentation.
Just got a message. I think Abigail had to step away. So what we can do is we can circle back around and cover this with the departmental update, but we can move on to the next agenda item so that we don't waste any additional time.
Okay.
All right, thank you. So Dr. Eccles, would you like to proceed with agenda item 6 with the departmental update, or we can actually move to board reports and then get back to your update?
I think we go into board reports would be good.
Okay, thank you. All right, governance and nominating committee.
Good morning, everyone. Happy to see you. So our main task right now with the Governance and Nominations Committee is to seek nominations for an open board seat. So as you are aware, Dr. Maddie Davis will be moving into the director's position. And so we will have one open seat on our board of 13 members. We would like to ask our fellow board members if you have nominations to potential nominations for our board, to submit them either to me, Dr. Jufra, or to Paul Lee. We are your members of the Governance and Nominations Committee. I'm going to put our email addresses in the chat just so you have them. Just as a reminder, we do ask potential board members to, of course, commit to attending our monthly board meetings as well as to serve on a board committee. So that is what we ask of our committee members. So seeking that nomination, and then we will go through our usual process. We do consider the credentials of those potential board members and conduct in-person interview, I guess virtual interviews with each of those candidates at the committee. And then our process is to bring those potential nomination to the full board for a vote. Would any of my fellow committee members like to add anything about the process or your thoughts on potential candidates? Okay, so that's it for us, Dr. Ballou.
Thank you, Linda. I do have a comment. So board members, please cast a wide net. And we would like to have diversity in our board members. I mean, not just diversity in the racial ethnic communities you represent, but in your disciplines and your experience in the community. Based on our previous agenda item on the wording for proclaiming racism as a public health issue, systematic racism, things manifest in social determinants of health, including housing and transportation and policing. And so, if we can kind of cast a wide, diverse net for board members that represent different disciplines and different social determinants of health or social areas, so that we can have kind of a robust response to problems in the city and to addressing really racism and social issues at its root cause. So I would just ask that we generate a good number of names and potential candidates so that we could have a bench and that we can have a board that is representative of some of the challenges and some of the solutions that we need to move the city forward in terms of health and well-being in general. Are there any other questions? Linda is putting the Governance and Nominations Committee members in the chat, so please. And perhaps, Linda, we could put some kind of deadline. So maybe in the next 3 weeks or so, would that be appropriate to have or the next 2 weeks to start to generate some names to vet? It does take a little while to vet the candidates, to get on folks' schedules and to get calls and to have the governance committee meet and to review all of the information and track the candidate down and then to present it hopefully at the next meeting. So Linda, what would be a good time frame to receive names so that you could get a presentation of potential candidates at the next meeting?
Yeah, that's an excellent point. So today is September 16th. Maybe we could ask for potential names by October 1st.
All right, thank you. And I will follow up in an email to all of the board members, just as a reminder.
Thank you very much.
Okay, wonderful, thank you. Academic Public Health Collaborations Committee.
Hi, thank you very much. So I'm reading this off the computer because there's a lot of things that are going on. I wanted to get some things into the chat and I will get those shortly. So the Academic Health Department between St. Louis University and County and City on the 27th of September, we'll be having Academic Health Department in Action. It's one of a 3-part series where we will start to explain more fully the academic health department as has been existing. Also, there will be a either virtual or in-person visitation by the public health students from St. Louis University in the city on November 5th, we think it's going to be. Did want to report that as part of our academic health efforts outside of the academic health department with St. Louis University, Audrey Coleman and Amy James from Washington University Medical School have reached out to city and county, and we are scheduled to do a presentation on October 18th about health equity and justice, St. Louis Community Health Needs Assessment, which will be talking primarily about what we've done in the past, but of course, past is prologue, as we see today. You all know about the Academic Health Department conference that is coming up on 3 days in the morning, October 13th, 14th, and 15th. That was one of the things that I wanted to put in the chat, and we'll attempt to do that in terms of that link that was sent out to the entire board. And you, of course, are all invited. It includes not only the Academic Health Department in Missouri here in St. Louis, but also Kansas City, in Kansas and in Nebraska. And then this is not specifically with the Academic Health Department, but I was going to put a link. I know that Tim McBride is fully aware of this because he is part of it, but the Institute for Public Health is having their annual conference, which is Transforming Public Health, Learning from the Past, Preparing for the Future, which will be October 27th from 8:30 to 12:30. That's going to be a hybrid presentation. And for now, that's what I have. Thank you.
Thank you, Craig. Would you also put the link in the chat for the conference, just to make sure that everybody.
Yeah, that's what I wanted to do. Thank you, Dr. Ballou.
Thank you.
Oh, I did want to thank you once again. When we submitted the Kellogg grant with your tremendous help on behalf of the board, when we applied for that. And the hope is, of course, as Dr. Eccles indicated, that we will be able to find some way to fund that effort across the city, because the health department is only as great as the rest of the city government is.
Sure. Missouri Foundation of Health has a new director as of May who
Yes, Dr. Proctor.
Area. Yeah, that might be a possibility. All right, any questions about the academic public health collaborations activities? Okay, the Health Communications Committee has been pretty busy recently, so.
Thank you, Rhonda. Dr. Ballou and I and Dr. Eccles, Harold Bailey, Kim Vandenberg, and a few other people were on a call with the Health and Human Services Committee of the Board of Aldermen on Tuesday to really follow up on what Dr. Ballou had started last spring when the alders of that committee were very interested in how they can get, information on COVID, how we were dealing with COVID-19. And Dr. Eccles gave some great information both on the survey that I will get to in a minute again, and the information he shared with us on COVID-19 in the city a few minutes ago. Then I was so delighted that Dr. Eccles, that we were able to have question and answer session with the alders. And I think, Rhonda, there were maybe 8 alders on our call. We had everyone on the committee was with us on the Zoom call. And we, Alderwoman Ingracia, who's the chair, went person by person through all the alders and asked them directly to share any questions they had with Dr. Eccles. And he gave complete and very, very helpful extemporaneous answers, to which I took many notes, to all the alders. And then they talked about, how a process for updating the information with them and we talked about the importance of them being able to be conduits to their ward, to people in their wards, because they hear, questions and they need information. So we talked about, a process for regular updates. Anyway, we were part of that, and our committee was part of setting that up way back earlier this year. So that was one activity that we did, which Dr. Ballou hosted and set up, and we were all part of. And Dr. Eccles was basically extremely engaged in the presentation. I mean, he did most of the meeting, and he did a tremendous job. The other thing that we did, and you all had an opportunity to help us with, was finalize the survey that is now out in the community to measure awareness and perceptions and attitudes toward directions we can take on 6 wellness areas, as well as get community input, citizen input into a tagline that we can use, into figuring out how much they've already heard about us and what we do. So I would like Harold or Kim to share with you where you can go to take the survey. I believe it's on the website if you live in the city. And I'm not sure if we are all supposed to live in the city to be on this board, but the survey will be out in the field for 3 or 4 weeks. And we talked on our call with the alders about how they can encourage participation to it. And then also we are asking them to follow up by setting up focus groups after we've tabulated the survey to help us dig deeper ward by ward into citizen, following up on citizen comments, open-ended comments on reasons for the survey results we heard, more community input. So Kimberly just put in the chat where you can go to take the survey, and also encourage your fellow citizens of the city to take the survey. We are also making provision for printing out hard copies of it that then the staff can upload into the Qualtrics online program, so that we can allow people who don't have digital connections or who aren't as familiar with that technology to be able to also take the survey. We may even do some group administration, but that, I think, is the first time in my few years here on the board that we've actually done a community engagement survey where we're casting a wide net. So that's basically our work for the next few weeks. We will have a committee meeting sometime in the next month, and I'll be back to you on that. We need some more work items to work on, but the survey has been our big activity. And I thank you all for looking at the questions before we before we launched it, before we said it was final. Are there any questions? Okay, thank you very much.
Thank you for the report. Ad hoc committees, I need to assemble, I have 2 volunteers to be on a committee for looking at how we evaluate our functionality and our effectiveness as a board. So you will receive an email from me in the next week just to think about how we evaluate board activities based on some of the information that Dr. Eckel sent from the National Organization on public health, local public health boards. So that is in progress, and that is the only update that I have about that. But for the sake of time, Dr. Moshe and Abigail, are you ready?
Yes.
Okay, thank you.
All right, thank you, Dr. Moshe, for the introduction. Let me go ahead and share my screen. I have a couple slides that I'd like to share. All right, can you guys see my screen?
Yes.
Okay, thank you. All right, so this is some research that we've been doing around mental health in St. Louis City. So this is just an overview of the US in general. Missouri is ranked 31st in the nation for prevalence of mental illness. So not doing too great. We're in the latter half of the nation. A lot of the measures used to determine the national ranking include adults with any mental illness, youth with at least one major depressive episode in the past year, adults and youth with substance use disorder in the past year, adults and youth with severe thoughts of suicide and major depressive episodes, individuals with any mental illness who are uninsured, who didn't receive treatment, reporting unmet need, and also individuals with disability who could not see a doctor due to cost. So these are some of the indicators that are used for gauging risk factors and mental illness prevalence within the US and also Missouri. And also keep in mind that, so Missouri ranks 31st in the nation, but also St. Louis City is one of ranks worse than Missouri, like in mental health prevalence and disorders. So just keep that in mind with all of this data. So this graph here presents the top or the prevalence of percentage of disorders within St. Louis City. The top 3 most prevalent disorders are depressive disorders, schizophrenia, and bipolar mood disorders. And also the rest of the data for this presentation also, it's from the Division of Behavioral Health, Mental Health Services, and Hospital Admissions. So the hospital admissions and clinical mental health services that are provided are a reliable proxy for measuring prevalence rates and risk factors within the mental illness. So one of the first risk factors that we assessed is age. As you can see in this graph here, St. Louis City has the highest rates per 1,000 population in every age category in ER visits. And this data came from the Department of Health and Human Services, so it's a little bit outdated. But as you can see in the graph here on the right, this is more recent data from 2020, but the trends also follow within areas, Missouri, St. Louis City, St. Louis County, and also age groups 25 to 64 have the highest are impacted most by mental illness. So the next risk factor is shows disparities by race within Missouri, St. Louis City, and St. Louis County. And once again, you can see that St. Louis City outnumbers Missouri overall and St. Louis County in every race category. So St. Louis City has higher prevalence rates of African Americans using clinical mental health services compared to Caucasians, with 40 per 100,000 or per 1,000 population, and compared to Caucasians with 15,000 or 15 per 1,000 population. And I think it's also important to note that the demographics of St. Louis City, African Americans make up a slightly larger percentage of the population with 45.3%. Caucasians make up 44.1%. However, they have much higher rates of mental illness and receiving clinical services within the St. Louis City. So the next risk factor that we addressed is gender. You can see that males are more affected by mental illness in St. Louis City than females, but it's the opposite in St. Louis County and Missouri. The top 3 diagnoses for adult females were mood disorders, anxiety disorders, and psychoactive substance use, while men were most affected by psychoactive substance use, mood disorders, and schizophrenia. I'd also like to point out that substance uses were both alcohol and or opioid related. So we know that recently in past years in Missouri and St. Louis in particular, the opioid epidemic has resulted in a lot of overdoses and deaths. So by creating collaborations and addressing mental illness and both substance use, we can kind of reduce some of those comorbidities caused by mental illness and substance abuse. And lastly, this is a stratification by education. And stratifying by education levels, once again, St. Louis City is most affected compared to Missouri overall and St. Louis County in every education level category. Individuals with less than a high school diploma or high school graduates had higher rates of clinical service use compared to those who completed some college and or advanced degrees. And lastly, this is a map showing the percentage of adults who reported that their mental health was not good for 14 or more days in the past month. And also, although this data is from 2018, it shows census tract level data within St. Louis City. So you can kind of see pockets of the population that are more affected by mental illness and using clinical psychological services. So up here in the St. Louis Promise Zone, you can see higher percentages of people who have reported poor mental health, and also down here in some of these pockets. And when we compare this to other chronic diseases, communicable diseases, this area is also predominantly or more, it's usually more affected by these diseases, chronic and communicable. And once again, here's the percentages of St. Louis City compared to the county and also Missouri. So the key findings from this research include depressive disorders, schizophrenia, and bipolar mood disorders have the highest prevalence in St. Louis City. Of all age groups, St. Louis City has the highest age-adjusted emergency room visits for mental health disorders, and the age range 25 to 64 has the highest rates of treatment utilization in St. Louis City. And there are evident disparities between African Americans utilizing services compared to Caucasians in St. Louis City. And lastly, the map of self-reported poor mental health shows increased percentages of mental illness in St. Louis Promise Zones in the southeast region of St. Louis City. And lastly, what is the Department of Health doing to reduce and control mental health disorders? So we've created community health programs that support behavioral health response within the community, conducting surveys in collaboration with St. Louis County and St. Louis University. And I think there's been surveys that go out for the county, like that census tract level data to report mental health, emergency room visits, et cetera, to kind of gauge that prevalence rate of mental health and mental disorders. And lastly, collaborations with Community Mental Health Fund and the Community Children's Service Fund. So I think going forward, I found this quote from some evidence-based research that I think will be good going forward for interventions to reduce mental health. Multi-sector and community-based mental health care approaches can help address social inequalities by promoting social well-being and addressing structural determinants of mental health, public policies, and other upstream forces that influence the social determinants of mental health. And lastly, I'd like to thank Dr. Eckel, Dr. Moshe, the epidemiology team with St. Louis Department of Health, and all my other colleagues who've assisted in this research.
Thank you, Abigail, for the report. At first, can we have access to a copy of the slides? I think that there are many of us that do work that relates to trauma and mental health in the community, and it would just be a great resource in doing our work. If you would, if we'd be able to get an access to a copy of the slides, that would be great.
Yes, I can post it in the chat.
Thank you. And have you considered relying any of these the mental health maps and mental health rates with indicators of community trauma and other socioeconomic factors and gun violence?
Sorry, can you say that? Can you repeat the question again?
Are any of the future steps in this research to directly relate some of the mental health indicators with other community indicators related to trauma and disenfranchisement?
Definitely. I think it's important to, they all influence each other. Mental health influences other socioeconomic factors, what's the word I'm looking for? Like societal factors. So I think it's important to understand how mental illness can kind of affect maybe more severe mental illness, violence, suicide ideation, and things going forward. So kind of addressing the youth population and that is affected by mental illness, and kind of, yeah, just utilizing resources, rehabilitation, etc. going forward.
Thank you very much for the detailed report. Any other questions or comments from any of our board members or guests?
That was an excellent report, Abigail. Thank you. One thing I always love to see is, kind of a geocoded map of mental health providers and see how that correlates with the areas of high prevalence of mental health disorders. And so I've seen maps, okay, and I've seen maps of the that you've shown, of the disease, chronic behavioral health issue, the rates, but I've never seen those maps superimposed. And I love it. I think we all know what it's going to show. Okay, it won't be surprising, but I think it will be important for the community to see that also, because we can then strike up another level of advocacy for increasing mental health providers in those underserved areas.
Thank you, Dr. Ross. Any other comments or questions? All right, we will move back up to our other agenda item. Dr. Eccles.
Yes, so just to piggyback on what Dr. Ross said, so one of the projects that the health department has started is the process for building the foundation so that the programs in the health department can have a public-facing dashboard. So all of the epidemiologists are being certified by Esri, which is the company that provides the geocoding software, ArcGIS. And so we'll be working to build that foundation so they understand the workflow and they can build more complex projects. They also will be working with the IT division and programs. So the first project will start with the Environmental Health Services division, because they have the most programs within that division. Also be working with them to establish the metrics that we deem to be most critical. We also want to have a process for receiving community input for this project, so that we make sure that the metrics and the indicators that are selected resonate well with the community and it's something that they think is meaningful. So we're looking to have that first dashboard up and running by summer of 2022. And then we'll be using that as a template to build out the public-facing dashboards for other City of St. Louis Department of Health programs. The next item on the agenda is transition. So
that was a question from Serena Muhammad in the chat. She says the microphone isn't working. Is the data on the rates of clinical services only for services through DMH? That is a significant distinction to make as we share this communication with the community.
And that's a question for Abigail and Dr. Motion.
Yeah, most of the all of the data came from the Department of Mental Health, the emergency room visits, or clinical service, my bad, yeah.
So likely it's representing only diagnosed cases, and they're probably disproportionate levels of undiagnosed cases based on socioeconomic status and community, I'd imagine as well.
Yeah, maybe if I may chip in, I think this is so far the only reliable source of information that we are having. Though, as Abigail mentioned, the county, City of St. Louis, City of St. Louis, together with the St. Louis University, we are planning to conduct a community-based, survey, by which we shall, we are designing a study, which we shall identify, the communities in a represented way of sample, by which we can reach a larger community to understand the actual picture, of the mental illness in the community, as opposed to just using the the hospital data. So I think, as you might understand, some of the limitation in the hospital data actually may exclude those ones who have no access. So by conducting this survey, I think we can, we can have the actual picture of what is going on in the community. And this is something that we are planning to complete by mid next year. Thank you.
Thank you, Dr. Moshe and Abigail. All right, Dr. Eccles.
Sue has her hand raised, so I want to see.
Sorry, was on my.
I'm sorry, I don't know how that happened. That was an accident.
Oh, okay.
Thank you.
It didn't pop up on, you were scrolled way to the left on my about. Now I see Candace has her hand raised.
Thank you so much. So this is a fabulous presentation. Thank you, Dr. Moshe and Abigail. Are there also going to be opportunities to get some qualitative data from the community, particularly on their lived experience with mental health and how that's been exacerbated by COVID? And then also when we think of stigma and mental health.
Yeah, thank you, Candice, for bringing that up. Actually, that is still under discussion in this initiative between the, St. Louis University, the county, and the and the city. There's a need to include the component of the qualitative component, and that is under discussion. But so far, we have managed to come up with a quantitative tool. Yeah, so all this, it is important to have the qualitative component, which will complement and come with a nice stories to understand what is going on, particularly the COVID pandemic. And actually, from other studies, we have seen that the mental illness, the COVID pandemic has played a significant role on the mental illness. So this is important to present it and to understand what is, if there's any, situation here, in the city, it's good to assess it and see. Thank you.
Thank you, Dr. Moshe.
All right. Thank you for the presentation and for the discussion.
And Dr. Moshe, I just want to make sure that Dr. Moshe sees my comment in the chat. Both Serena and I agree that the data could look very different once you include private pay or even grants through agencies. And I wrote a message to Dr. Moshe saying, I do belong to a networking group of over 1,700 therapists in St. Louis. It's just a group where we share information. So if there is a survey that I can share in that group, I would love to do that. That will give us a bit of more data. And, this is mostly going to be data from private practices. Some agencies. Mm-hmm.
Okay, actually, that's a great help. As I mentioned before, we are struggling to get, to pull up this data from different sources, but by you complementing such information, actually, it would be a great help to improve this report. So I shall try to reach you separately.
Perfect.
For such additional information. Thank you very much.
Of course, thank you.
All right, thank you. Thank you, Alma, for offering that. All right, Dr. Eccles, transition plan.
Yes, so everyone knows that Dr. Maddie Lashuel Davis will be starting as the Director of Health for the City of St. Louis. Her start date will be on October 18th. And so we're in the process of transitioning responsibilities, reviewing the table of organization and working with the mayor's office to make sure that the delegation of duties is consistent and compliant with what's outlined in the city charter. So we'll be making sure that once the decisions as it relates to the structure of the department are finalized, we'll make sure that information is conveyed to the board members so that you all understand what the structure of the health department is and what each of our roles and responsibilities will be as we move forward.
Thank you, Dr. Eccles. Do we have any questions about that transition plan? Any questions, comments?
Yes, I do have questions for Dr. Eccles. I just want to know what his plans next, because we will miss him most for all this time that he's helping with the health departments. So what's the next plan, Dr. Eccles?
The next plan as it relates to
He's going to remain the commissioner, so he will still be
I see.
at the health department. He'll remain as a commissioner. I mean, the past several years, the commissioner and the director positions have not been, both of them have not been filled. So now we'll actually have a commissioner and a director.
Oh, great.
Could I step in and ask a question?
Of course.
Well, first of all, you know, I'm really pleased that you're going to stay in the role of commissioner. Dr. Eccles, we really have an embarrassment of riches now. We have not only your expertise and all the great work you've been doing, but now we have Dr. Maddie. So, you know, we have like twofer. So like a power couple, really. So so this will be great for the city. So thank you for your continued role in the city. And it'll be great to continue to work with you. My question relates, and I really sincerely mean thank you for all your hard work. And my question relates to the charter. And I know I meant to bring this up earlier, maybe in Linda's presentation. I know we're still working on figuring out the charter, which kind of makes my mind go, you know, it's a mess. You know, the Board of Hospitals and Health and all that. So the Commissioner of Health, the board, the director, I know we're sort of working on that. How does this new role you have, or you're sort of, I think you still have this role. Anyways, how does this relate to the charter, accreditation and all that? Do you want to speak to that?
Dr. McGraw, can I just make a comment about that? I'll certainly let Dr. Eccles.
Yeah, if you would, I open.
Yeah, the governance committee and you know, Linda is a lawyer, was extremely helpful in reviewing the charter. So the governance committee, we reviewed the charter and went through and really identified things that were kind of antiquated because we're no longer a board of health and hospitals. There's no hospitals to manage, and made some suggestions about the charter, contacted the key officials and staff at the mayor's office. And we went and presented the proposed charter changes to the mayor, which involved updating to credentials, because we no longer updating the required credentials and the job description, and that's still a work in progress. And also merging the Board of Health and Hospitals into just the Board of Health, but maintaining the current number of seats, right? Because if you actually divide up the Board of Health and Hospitals, if we were to eliminate the Board of Hospitals, we'd have a very small Board of Health. So I proposed those changes that were developed by the governance committee to the mayor, and she said that she would be doing a comprehensive charter review for all of the city agencies during her first term at some point, and that would be part of the charter review. And she said she agreed with the changes and took the notes, and that it would be part of a charter review when that happens. So that's kind of the status of the charter in terms of how this current administration is going to handle charter updates and changes. It will all be done at once when the mayor's office does a comprehensive charter review for all city agencies.
Well, thank you. That answers a lot of my questions, but go ahead.
I just wanted to say that, because that kind of drives the charter changes that we have discussed over the past few months. Sorry, Dr. Eccles, do you want to also?
And I'll answer the portion of the question related to the accreditation. So accreditation and charter changes are two separate, completely separate things. So the accreditation is really, the health department's responsibility to implementing and adhering to the standards that have been established by the United States Public Health Accreditation Board, or what we call FAB. And so that process is ongoing. So we identified some gaps within the department at the start of my tenure. And so we have increased capacity as it relates to quality improvement performance management. So there's a quality improvement performance management manager. Rhonda Bartow has been hired to fill that role. We also have a health educator, public health educator, and a public health marketing administrator that will be assisting in that work. But then we also will continue our efforts to make sure that the quality improvement performance management efforts that need to be conducted are really integrated into the day-to-day activities of the program. So it's not something that we're struggling to do when it's time for us to seek reaccreditation. So it really has become a part of the culture. So we work to make that happen. And we do know that we're up for reaccreditation in 2023. The FAB standards will likely be updated in 2022. And so we'll be paying really close attention to those standards and any revisions to make sure that we're in compliance and also to make sure that we're well prepared in the, when it's time for us to submit our supporting documentations for reaccreditation, so that hopefully we'll have no hiccups in being reaccredited when the time is due.
And Tim, if I could just add one more elementary point about the charter. The charter for the board does define separate roles for the director and for the commissioner. And while some of the changes we were seeking in our proposed revisions to the charter, which, as Dr. Ballou explained, are sort of on hold right now, given all the transition, et cetera, there'll be no changes proposed to the roles of the director and the roles of the commissioner. The director's roles are defined in the charter as being responsible for the supervision and coordination of all activities of the Department of Health and Hospitals. The commissioner has separate responsibilities, which are to see that the laws and ordinances relating to public health are observed and enforced, and then has responsibilities and powers directed toward those enforcement responsibilities. So under the charter, both director and the commissioner have separate responsibilities that are articulated. None of the changes that we had proposed would alter in any way the individual responsibilities of those two positions.
Any other comments or questions? So, you know, I'll certainly commend Dr. Eccles, because he has been been serving in the director and commissioner role and kind of handling everything, and managed the city through a pandemic. And so yeah, I just certainly like to give Dr. Eccles a round of applause for doing it all over the past couple of years, really doing both jobs. So, you know, thank you for really serving as the commissioner and the director, and working tirelessly to keep us safe during the pandemic. And we know that it was stressful. It was a lot of work, and it sometimes felt thankless and tiring. And we just want to let you know that it's greatly appreciated. Any other comments? I don't see any hands up. So based on Dr. Maddie's start date, which is, what is it? It's the, Dr. Eccles, could you remind me? It's the
October 18th.
It's October 18th. So technically, and I need to update the agenda. So given the third Thursday, since the first Friday of October since the first day of October is actually a Friday, the third Thursday, which is our meeting, so there needs to be a correction to the agenda. Our next board meeting is on the 21st. So technically, Dr. Maddie will be serving as the director for our next board meeting. So the transition will occur for our next board meeting, and Dr. Maddie will be in place as the director at that point. So any other questions and comments? Again, we're eternally grateful for all of Dr. Eckel's work, and very happy that he will be staying at the health department and serving as a commissioner. Any other comments? I know we are at time, and we have a couple of other wrap-up items, but Dr. Eckel's just outstanding and well done. So any department updates?
Just a couple of updates. So we were having discussions with the Centers for Disease Control regarding additional support for the health department as it relates to COVID-19 and some data management as well as communication. And we also were approached by the National Association for County and City Health Officials and the CDC for a funding opportunity related to substance use disorder. So we are working closely with them to develop the quality improvement tools that will be used, as well as the scope of work. And so we'll likely get the notice of award in January, but right now we're having early discussions about what that project could actually look like. We're also working with the Department of Justice to refine the scope of one of the previously funded funding opportunities related to substance use disorder. So myself and Craig Smith, as well as our project officer with the Department of Justice, are working to get that up and going. We're also working to properly utilize the ARPA funds that have been appropriated to the department for various service categories. So we'll provide an update hopefully be able to provide an update to the board next month on how that funding is being spent, as well as what activities have resulted from the utilization of those funds. And other than that, we're working, as Lisa mentioned, to really bridge the gap as it relates to communicating with the Board of Aldermen and really giving them more of a active role to help be public health champions in their respective jurisdictions. And I think evidence of how they can really be impactful as it relates to public health is during the last hearing or session, where they voted to extend the face covering mandate. And so they all came together and voted unanimously to get the extend the face covering mandate in the city. And so those types of things are things that they can champion on our behalf, especially when we have state legislation that kind of limits our authority. And so we'll be working to really work more closely with them so that they're in tune with what the needs are, as well as what's happening in the city of St. Louis.
Sorry, I was muted. Thank you, Dr. Eccles. We don't want to push us over time. Any old business or announcements? Okay. So correction, our next board meeting will be October 21st. Same time, same place, on Zoom. And so now I moved it that we adjourn if nobody has any comments or announcements or anything else.
Need a motion?
Yes, I need a motion, please. Thank you.
Move adjournment.
Second.
Second.
All right. All in favor?
Aye.
Aye.
Opposed? I didn't think we'd get any no's there because we're 3 minutes over time. All right, thank you everyone so much. Be safe and be healthy until we meet again on October 21st. And thank you for all the presentations, and thank you again, Dr. Eccles, for all of your hard work. Thank you. Bye.